So we are at the part of the program where we introduce the presidential lecturer, the Harry Farfan presidential lecturer, and it gives me great honor to introduce to you Dr. Tat Leang, who is currently working as a professor and a senior consultant at the Department of Anesthesia, National University Health System. By way of background, he graduated in 1976 from the National University of Singapore and obtained his Master's of Medicine in Anesthesia degree and a fellowship of the Australian and New Zealand College of Anesthesiologists in 1982 and 1984 respectively. He was also awarded the Cecil Gray Prize by this organization in 1982. In addition, more importantly for this particular lecture, Dr. Lee also holds a certificate in acupuncture and moxibustion from the Chinese Academy of Traditional Chinese Medicine from Beijing, the People's Republic of China, and is the clinical instructor of acupuncture service at the National University Hospital. Dr. Lee has been involved in the process of training and examination in anesthesia in Singapore since 1985. He was head of the department from 1991 to 2003, and he chaired the Special Training Committee and the Residency Advisory Committee for the anesthesia during this time, and is still a member of the Residency Advisory Committee. Obviously, Dr. Lee has served in many national and international professional organizations in the leadership roles. To name a few, the Singapore Society of Anesthesiologists, the Asian Australasian Regional Section of the World Federation of Societies of Anesthesiologists, and the Asian and Oceanic Society of Regional Anesthesia and Pain Medicine, just to name a few. As president, I felt this topic on acupuncture would be something very apropos to our society. We deal with many aspects of pain when we do research on lumbar spine. So being that we are being hosted in Singapore and in the Far East, I felt this topic was germane so that Dr. Leang can educate us on a topic that I think we would very much enjoy hearing. So I want to bring Dr. Leang up to the podium so he can give us his Farfan lecture entitled The Use of Acupuncture for Musculoskeletal Pain.
For the very kind introduction, members, distinguished guests, members of the ISSLS, ladies and gentlemen. It's my great pleasure and an honor to be here today to address members of this distinguished society, and also in particular under the lecture named after the legend and founder of this distinguished, prestigious society, Dr. Harry Farfan. So due to time constraints, my lectures will go like this: a very brief introduction to the concept of acupuncture and traditional Oriental medicine, and the Singapore perspective in this respect. And then I will just zoom in on the role of acupuncture in musculoskeletal pain, and to fit the theme of this meeting, using chronic low back pain as an example, and citing whatever evidences I could find from clinical research, and to present a little bit of the challenges that acupuncture research or invasive technique, including surgery in general, that help to fulfill a randomized placebo-controlled trial. For every patient you guys successfully operated, there are many more that are still suffering from pain and loss of functions. And no man is an island, and therefore I'm here to help my team, spine team, to get these people relieve their symptoms and comfort. Most logical step in treating any pain would be the use of analgesic, but currently there's a great unmet clinical need in the number of analgesics we have clinically. And in addition, for treatment of musculoskeletal pain, as you can see, that there are very high failure rate up to 80% in chronic low back pain. Acupuncture's topic is on acupuncture, but make no mistake that acupuncture is only a treatment modality under the umbrella of so-called traditional Chinese medicine or TCM or Oriental medicine, which is widely practiced in North Asia, China, Korea, Japan, Taiwan. In fact, the most commonly used and most popular form of TCM usage would be herbal medicine. And then followed by acupuncture, they have a therapeutic massage called tuina, as well as proper diet and nutrition to promote and maintain health, as well as exercises such as the well-known Tai Chi and Qigong. Nobody knows exactly what's the history of acupuncture. Probably 5,000 years old, started somewhere in China. But before you dismiss this cartoon is a joke. Just to illustrate the breadth of alternative and complementary medicines, there are people in the world has been advocating the use of bee venom to treat a varieties of rheumatic and autoimmune diseases. And somewhere in South Korea now, there is an RCT, randomized control trial going on using bee venoms to evaluate its role in chronic low back pain. Now, in Western setting, we always say acupuncture, acupuncture, but there are two Chinese characters. In Mandarin, we call zhen jiu. So, the needle parts come from a Latin words, and it refer perhaps the prominent components called needle. And what is totally ignored is the even more ancient healing technique, the use of heat. And obviously, traditionally, historically, the heat before invent of electricity, fire is used to generate heat. And this is how the Chinese word fire evolved over time. And this composite slide, so it's 20 years ago when I did my clinical fellowship in Beijing, and you can see there are various ways you can apply this moxibustion. The classic traditional theory in TCM is your well when the qi, this life force energy, flow uninhibited within your channels and meridians throughout your body. And you are sick if this flow is sluggish or even come to a standstill. And in certain TCM diagnosis, if the diagnostic syndrome fit into cold, damp, heat, then you use, in addition to acupuncture, the use of heat is to re-establish flow of the underlying qi. If your diagnosis is heatiness, for example, then you should avoid this particular modality of therapy. Another very common adjunct used in acupuncture clinic is the use of cupping, the use of suction generated from traditionally a cup made of glass, and invariably they will leave a leopard spot mark on the skin. And this is probably 1 day old, this is probably 4 days old. Now coming to acupuncture. Over the years, there are different schools of thought. You can see that how we stimulate the acupuncture point, it could be using needle, it could be using physical methods such as finger pressure, we call acupressure, electrical, transcutaneous stimulation, or even laser. Even for needle acupuncture, there are various steps of insertion, from very shallow subcutaneous, which is popular in Japan, through deeper tissues, muscle, as well as periosteum. So this illustrates the problem in comparative study in clinical acupuncture practice, as well as making meta-analysis impossible. Obviously, this ancient healing technique has come a long way, but if you look at literatures, the scientific research in acupuncture is only started somewhere around the 70s. There were 3 scientific issues as to why around 70. Number one, the gate control theory has been proposed. So for the first time, we can explain how acupuncture works. And then the opioid receptor has been cloned in the 1970 soon after that, a year later, followed by the isolation of endorphins. But scientific publication will not generate public interest. What is generate public interest were the media exposure. What happened in 1971? The late President Nixon visited the late Chairman Mao. And there's a big entourage of reporters, and one of them was the ex-chief editor of New York Times by the name of James Reston. He had acute appendicitis when the group was in Beijing. He was operated on by surgeon and received Western anesthesia, but post-operatively he suffered terrible pain due to ISSLS, and the surgeon said, "I'm sorry, we couldn't do anything for you, and would you like me to refer you to a TCM practitioner?" And he accepted their offer, and he was treated with acupuncture, and he felt great relief, and he did what the reporter did to write about it. And following President Nixon's visit, mainland China has opened up limited visit to groups, including medical groups, and they have a strict itinerary to follow. And one of the items on the itinerary will be invariably visit hospitals to witness how major surgery, including thoracotomy and laparotomy, performed on a weak patient under acupuncture anesthesia. But I personally objected to the term of acupuncture anesthesia. Acupuncture can induce analgesia, but not anesthesia. So our group has been actively promoting the use of acupuncture for the treatments of all kinds of chronic pain in Singapore. And since the establishment of the clinic, our medical school students are also getting interested to know more about the topics of complementary and alternative medicine, and we actually have a 2 weeks elective for our medical students to attach to our clinic, as well as our Western chronic pain clinic and acute pain service to expose them to a full range, the holistic care of pain management in our in-hospital patient. The Ministry of Health in Singapore in the mid-90s did a survey and found that almost 1 in 2 Singaporeans has visited a TCM practitioner. And with that, in the interest of public safety, and the government decided to legislate and regulate the practice of traditional Chinese medicine in Singapore. In the year 2000, December, Traditional Chinese Medicine Practitioner Act was passed by the Singapore's Parliament. And with this, it empowered the establishment of a traditional Chinese medicine practitioner board. And this regulate the training as well as credentialing of all TCM practitioners in Singapore, whereas all Western trained doctors are under the jurisdiction of the Singapore Medical Council. So as I who practices 2 specialty, and I have to carry 2 licenses when I'm at work. One allowed me to practice anesthesiology, and the other one allowed me to practice acupuncture. Okay, time doesn't permit me to go into what is the mechanism of leading to acupuncture-induced analgesia. It's like somebody, just to suffice to say that, according to traditional theory, you are not well when the flow of this qi is blocked or becomes sluggish. So acupuncture is to promote the flow of this life form energy within your meridian and channels. So with contemporary understanding of neurophysiology and research, basic science research established that during acupuncture stimulation, both in animals as well as in human beings, it stimulates the release, both in the spinal cord as well as central nervous system, a release definitely endorphins, and as well as other types of neurotransmitters that are known to deal with pain. And also, as I mentioned, the neural circuit identified in Western pain management can be used to explain acupuncture's that the acupuncture stimulation block sensation at the dorsal horn of the spinal cord using applying the gate control theory, as well as stimulating the descending inhibitory mechanism from the midbrain. This to me, acupuncture also has a local mechanism, and this to me is the most effective way to treat certain musculoskeletal pain. If on physical examinations at trigger points, or points have been found. And of course, one of the critics of acupuncture, would say that acupuncture is a pseudoscience, and because its treatment effect is due to placebo, and I'll touch on that later. So as I mentioned, I use chronic low back pain as an example to illustrate what's the role of acupuncture in the treatment of back pain, and we'll cite evidence from clinical research, and also what's the challenges facing any invasive technique using contemporary randomized controlled trial framework, including other intervention, pain therapies, and pain management. First of all, we all know that it is common, and low back pain occupies 60% of our total patients that suffered pain that visited our clinic over the last few years. We all know that it has significant economic costs on the individual and the society at large. And this data from USA just released last year shows that in USA spend almost 15 billion on complementary and alternative care that include acupuncture, and low back pain itself consume almost more than half. Now, how do we choose? We'll show you a buffet list later. There are many controversial assists on the effectiveness of the available option. And this is just the content page that I extracted from this journal called Spine Journal, who devoted the entire issues, listed at least 24 types of non-surgical therapy for treatment of pain other than surgery. That includes needle acupuncture as well as a very familiar epidural steroid injection. So it comes down to research. For clinical research, we all know that we have quantitative research, or we can perform qualitative research, which I will not be touching on. For quantitative research, the gold standard would be a randomized controlled trial. And most journal with high impact factors will demand an efficacy trial, which means that your treatment must be compared with a sham or a placebo arm. So for acupuncture, the question asked would be, how efficacious is acupuncture in the treatment of chronic low back pain as compared to placebo acupuncture? However, now there's a resurgence of people that opted for effectiveness trial, or what we call pragmatic trial. So the question asked would be, how effective is acupuncture in the treatment of chronic low back pain as compared to, in your society, the best care or the usual care, such as pharmacotherapy and or physiotherapy. But you can see that RCT turns out the result may not apply to all the patients that you see from a day-to-day basis. For the placebo-controlled trial, the demand that the treatment must be standardized for all the patients. This is not what we do in the clinic and the operating theater every day. And there are very stringent inclusion and exclusion criteria, so the patient population are very homogeneous, and this is not the type of patient that we see every day in the clinic. And the objective are usually limited to one primary outcome and maybe a couple of secondary outcomes. However, it has a very high internal validity. So next few slides, I will show you data from efficacy studies of acupuncture on chronic low back pain. In other words, all these studies would include a placebo arm. So the first two are systematic review, and the last one was a randomized controlled trial, which was not included in the two previous systematic review. Conclusions, very straightforward. True acupuncture treatment are no more effective than sham acupuncture. They're equal. But true acupuncture and sham acupuncture were more effective than no treatment. So, what do you conclude from that? Number one, the beneficial effect of acupuncture are due to what we so-called placebo effect or reporting bias. Two, the the placebo acupuncture intervention might be associated with a very potent non-specific or placebo effect. And classically, we thought there's no more than 1/3, 33% of the population are susceptible, would give rise to placebo effect. But now we know that that assumption is wrong. Thirdly, placebo acupuncture intervention, they are not inert as we thought they should be, like sugar tablets, a drop of saline, and so on and so forth. There are numerous types of sham control or placebo control has been used in various acupuncture study, and some of this might actually physiological active effect rather than inert. So it's a confounding factor. This one the result just published 2 years ago from Korea and showing that this is an efficacy trial that shows that individualized acupuncture treatment actually reduces or better than sham acupuncture in terms of bothersomness as well as pain intensity of chronic low back pain. Just sidetrack a little bit on placebo. Placebo is a tool that we use in RCT placebo control trial. It could be a tablets, inert sugar tablets. It could be a device, say an ultrasound that is not switched on and a stimulator that is insulated, there's no current passing through, or even a suggestion. And we always thought that the placebo is not physiologically active. It should not elicit a response, but now we know that assumption is wrong. Placebo effect actually can incite and provoke a complex neurologic mechanism involving neurotransmitters. And you look at this list, endorphins, cannabinoids, dopamines, they are all related to pain treatment in one way or the other. And they also activate specific, quantifiable and relevant area of the brain. And this has been shown by PET scans and functional MRI. One you wonder that why pharmaceutical company make so much effort about putting pills of different colors. The red color pills actually stimulate your mind. And the yellow one has been found by pharmaceutical company best suited for depression. No wonder the world best selling energy drink combine these two colors. Now you understand. And so is Ferrari. And green is the best anxiety anxiolytic drug. Look at Tomicum. And Tat is invariably a white in color because it gives you a soothing kind of feeling. Even before you drink it, your gastric already gone by half. The more the better. Brand name is important. I never realized that the word Viagra is derived from vitality and an unstoppable, like rara, sexy. Okay, just two examples that placebo response is not just restricted to patient reporting to you, I'm feeling better. It actually an objective sign. This study that conducted almost 50 years ago by one of the anesthetists involved, Henry Pitcher. And they give patients saline. And in half of them, they actually has constricted pupil. I never heard of normal saline give constricted pupil, but if you believe that that's saline is morphine, then they develop constricted pupil. And the next study, also a very old study, ultrasound has been used by dentists during dental surgery to reduce pain as well as inflammation. So this double-blind control trial is the ultrasound machine was switched off without the patient or the practitioner knowing this. So for those who are switched off, the patient also report good pain relief. Objectively, the swelling also reduces. So are all placebo effect equal? The answer is no, as I already show you. Parenteral placebo is more effective than oral. That's why GP always give injection. Sham acupuncture device, a device has a greater placebo effect on subjective outcome compared to a pill. And the intervention might be definitely larger than pharmaceutical than other physical placebo. Now what if, see when we do a trial, it is involve a placebo arm, it involves deception. In other words, when you take consent, you tell the patient you have 50% chance that you receive placebo, which doesn't work, and 50% chance you receive an active treatment that it definitely will work. But what if you tell the patient that you're actually receiving placebo? You remove that deception, right? So that's what this Harvard group has done. To test whether open label placebo, non-deceptive and non-concealed administration is superior to no treatment control in patients suffering from IBS. So one group received no treatment, the other group were told that you are taking fake inert drug at the bottle label, big label placebos. And open label placebo produced significantly higher global improvement. So, how nice, you tell the patient you have tea leaf and just make sure that you believe he has a tea leaf, but you actually didn't have any improvement. Okay, so now our effectiveness trial, so-called pragmatic trial, means there's no placebo control, that acupuncture add on or compare to usual care such as pharmacotherapy as well as and/or physiotherapy. So these two studies both shows that acupuncture add on others better than physiotherapy alone, and they are also more cost effective. And this is the Royal College of Surgeons systematic review also supported this. There's another pragmatic study. It shows that one group intervention and the other group control, meaning they are receiving whatever the standard care in the community. And they found that pain outcome is better than in the intervention group. And just another paper showing that, at least this paper from UK, showing that acupuncture is cost effective. Now what about the other gold standards for treatment of low back pain with or without sciatica and radiation epidural steroid? This is efficacy study, means that epidural steroid injection compared to placebo injection, no effect. Conclusion, insufficient evidence to support the use of injection therapy in acute, subacute and chronic low back pain. And this Cohen, in this editorial in the British Medical Journal, actually concluded after 35 studies have failed to provide a definitive answer regarding the efficacy of epidural steroid, it is unlikely that future trial will do so. So in other words, hinting that we should stop doing trial comparing epidural injection versus placebo. So of course, people always never say die. So there's this pain management physician that comparing epidural steroid, just like acupuncture, compare with conventional care. And they are positive. They show that they are better. And in fact, these authors in the discussion say that placebo-controlled neural blockade is not realistic. They also cited issue that it's not ethical to do so. This is what happened 20 years ago. I was in China studying acupuncture. My colleague told me, you no need to do study, it works. Number two, we cannot do randomized double-blind control in China because everybody knows how acupuncture feels like since young. So, thirdly, they also say that pragmatic study are considered more appropriate rather than the explanatory trial, i.e. using placebo control. So how about vertebroplasty? We all know that it could be very effective in improving patients' quality of life. On the same issue, a New England Journal of Medicine bomb dropped in 2009 from two independent groups, which shows that vertebroplasty is a placebo effect. And now following that, there are many effectiveness studies comparing vertebroplasty and conventional care, physio, bed rest, plus analgesic, and they are positive. Vertebroplasty is better. So, what do we get so far for acupuncture as well as intervention therapy such as epidural steroid injection? If you do a placebo-controlled trial, invariably you will turn up negative. If you do a pragmatic study, it could be positive. So it's editorial in the Spines stated that it seems that in our current cost-conscious environment when it comes to acupuncture for chronic low back pain, especially when other dependable and safe clinical options are unavailable, the medical community puts effectiveness above efficacy. So there's a mind change in terms of conduct the framework of clinical research. So this slide just summarizes that's currently what are the clinical guidelines for chronic low back pains in many well-known society all over the world, in America, UK, Germany, and where acupuncture is recommended as a treatment option of patients with low back pain. Acupuncture should be provided to patient who has non-specific low back pain, no threatening to the spinal cord or any nerve, non-responsive to conventional therapy, and as requested for acupuncture. So this slide shows that acupuncture, at least in our clinic, has been used to treat a wide varieties of musculoskeletal pains, and literature shows that it's very good for headache, particularly tension headache and others musculoskeletal condition. Many years ago, we performed a study that shows that electroacupuncture started before surgery and throughout surgery has significantly reduces intraoperative and postoperative morphine and fentanyl requirement. And this was subsequently substantiated by a systematic review. So I think I've bored you enough, and I would like to thank all my colleagues that have been helping me in the clinic over the last 18 years or so. And thank you very much again for your invitation and the kind attention.